Hey everyone, greetings from Dr. Prepper. I'm back with another clinical question for us to talk about. So we here at Dr. Prepper aim to discuss the concepts around these clinical questions to help you solve them better when they come for your NEET. So let's go get you that PG seat and let's dive right into today's question.
So the question for today is, nerve supply of the extraocular muscles is by all except the ophthalmic nerve, oculomotor nerve, trochlear nerve or the abducent nerve. So the correct answer to this question is A, that is the ophthalmic nerve. So now we have to look into how we approach this question and how we came to the right answer. So the topic from which that question is taken is the extraocular muscles. So we start with a basic background of which are the extraocular muscles. So there are 7 in number. The first one being the levator palpebrae superioris, and as the name suggests, palpebra is for the eyelids, superioris as in the upper eyelid, and levator as in it lifts the eyelid and helps in opening the eye. The next set of muscles are the recti muscles. So there are 4 in number, and they are the superior rectus, the inferior rectus, the medial rectus and the lateral rectus. The last 2 muscles of this set are the obliques, and they are 2 in number, namely the superior and the inferior oblique. So let's see how these muscles are attached around the eyeball. So let's start with learning about these muscles by learning about their origin and their insertion. So the origin of most of these muscles, apart from the inferior oblique, is from this annulus of Jin that you are seeing here. This is actually a common tendinous ring found at the back of the orbital socket, and from this common tendinous origin is where all the muscles originate from and attach to the eyeball. The insertion of these muscles on the eyeball are at different points, and that I'm going to try and explain to you how these attach, because it is very crucial to understand these attachments to understand the movements these muscles cause. So the origin of the inferior oblique is from the floor of the orbit, and it inserts beyond the equator on the inferior surface of the eyeball, and that contributes to its actions, which we are now going to look at right after we have figured out the nerve supply of these muscles.
So now that we know where these muscles originate from, we should look at where they insert onto the eye. And knowing the insertion and orientation of these muscles is actually very important, because it will help us understand their actions a little more better. So to demonstrate the muscles of the attachment of these muscles, I'm going to use this common household bowl that I found in my room. So let's imagine this is the eye. We look at it as if it is the right eye. So this eye has been divided along the coronal plane into 2 halves, the anterior and posterior half, by something which is called the equator. So now the muscles, as you know, they originate from this common tendinous ring which lies behind the eye, as I spoke about previously, and the muscles originate from this and go on and attach to the eye. So what I want to remind you is this common tendinous ring is not in the center of the eyeball behind. It's actually a little bit towards the medial aspect. So from there the muscles originate. Let's start with the simplest one, the medial rectus muscle. This muscle, I will use my fingers to demonstrate the orientation of the muscles, and they are brown also for good measure to help you understand. So let's go. So the medial rectus muscle comes from the common tendinous origin and goes and attaches in front of the equator onto the medial side of the eyeball. Similarly, the lateral rectus attaches onto the lateral side of the eyeball. The superior rectus also goes up on ahead, crosses the equator and attaches in front of the equator onto the eyeball. Similarly, the inferior rectus attaches inferiorly but in front of the equator. Coming to the 2 remaining muscles, which is the obliques, the levator palpebrae superioris does not attach onto the eyeball. That attaches into the lid and is responsible for lifting the eyelid. So coming to the oblique. So as you know, the superior oblique comes from the common tendinous origin but winds around the trochlea, which is like a sling, and then turns backwards and attaches onto the eyeball. So that also has an oblique orientation where it is anterior and slightly medial and comes and attaches behind the equator onto the eyeball. Similarly, the inferior oblique, which arises from the floor of the orbit, comes and attaches behind the equator, behind the eyeball. It attaches somewhere here. It's like this. If you look at it from the side, from the floor, it attaches like this. So all the recti come from behind, attach in front of the equator. Both the obliques come from the functional part of the superior oblique and the inferior oblique come from the front and attach behind the equator. So now you know where these muscles attach onto the eyeball, and I would like you to go through that well, because that is what is going to be very crucial in understanding their different actions. So now that we know about their insertion, let's go on to the nerve supply.
So coming to the nerve supply of the extraocular muscles. The extraocular muscles are supplied by 3 cranial nerves, namely the oculomotor, the trochlear and the abducent nerve. These are the 3rd, the 4th and the 6th cranial nerve. As you know, there are 12 cranial nerves in total. These are the 3rd, 4th and 6th nerve, which are purely motor nerves which supply the extraocular muscles. So the superior oblique muscle is supplied by the trochlear nerve, the lateral rectus is supplied by the abducent nerve, and all the remaining muscles, as in the remaining recti and the inferior oblique and the levator palpebrae superioris, are supplied by the oculomotor nerve. So this slide itself gives us the answer to a question that we saw earlier as to which of these nerves does not supply the extraocular muscles. And there the correct answer was ophthalmic nerve, which is a purely sensory nerve. Therefore, that was the right answer to that question. So remembering a question comes from here that is very often cause confusion is like which nerve supplies the levator palpebrae superioris. The answer lies in this slide itself, where all the remaining extraocular muscles are supplied by the oculomotor nerve, and therefore the levator palpebrae superioris will also be supplied by the oculomotor nerve. And that is very important to know. Now that we have understood the nerve supply and figured out some questions, let's look at the actions of these muscles, from where a lot of other questions are asked. So now that we have seen the nerve supply of the muscles, let's look at the action of these muscles. So let's start with the simplest, the medial and the lateral rectus. Now that you know where these muscles attach, it's very simple that one causes adduction, which is the eye turning medially, and one causes abduction, which is the eye turning laterally. Now the next few muscles are a little more difficult to understand. So we'll go by their primary, secondary and tertiary actions. So the superior and inferior rectus, their primary action, which by their attachment is very obvious, is elevation and depression. So the superior rectus causes elevation of the eyeball and the inferior rectus causes depression of the eyeball. Their secondary action is intorsion and extorsion, the movement that I explained earlier. So because these muscles are their origin is sort of on the medial side and they attach on the lateral side of the eyeball, if both contract, they sort of pull the eye inwards, and therefore they cause intorsion, and the superior rectus will cause intorsion and the inferior rectus will cause extorsion based on their attachments. A very tertiary and minor action is adduction for both of them, because they both connect from the medial side and attach onto the lateral side. Now coming to the obliques. The obliques, due to their peculiar attachment, the primary action becomes intorsion and extorsion based on how they attach. Their secondary action is depression and elevation, and remember, this is the opposite of how the recti cause. The superior rectus causes elevation, but the inferior oblique causes elevation here. So that is important to understand, which we will go into further. And a very tertiary action for them is abduction for both of them because of the way they are attached. So they both come from the lateral side actually and attach onto the medial side of the eyeball, therefore causing some degree of abduction also. So let's look at the model and try to understand how the attachment contributes to these movements.
Let's get back to the bowl. Now that we know where the muscles insert, it will be very handy for us to understand how they act or what their respective actions are. So let's go back, as we remember, right eye. We'll go to the simplest one, which is the medial and lateral rectus. So the medial rectus attaches in front of the equator onto the medial aspect of the eyeball. So as you can see, I'm contracting my fingers. The eye is adducting, which is turning inwards. So that is the action of the medial rectus. Similarly, the lateral rectus attaches onto the lateral side, and when the lateral rectus combines, the eye turns laterally, which is called abduction. That is the two simplest muscles because they have only one action. Now it gets a little tricky. So coming to the superior and inferior rectus, I want you to first understand what the actions mean. So they are mostly responsible for elevation and depression of the eyeball. So elevation is the eyeball turning upwards and depression is the eyeball turning downwards. So as we know, the superior rectus goes on from its origin and attaches on the superior aspect in front of the equator. So as you can see, if it contracts, it causes the eyeball to go up. Similarly, the inferior rectus, if it contracts, it causes the eyeball to go down, therefore causing elevation and depression respectively. Coming to the obliques, the main action of the obliques are actually intorsion and extorsion. So what is intorsion? Very easy to remember. We will focus on the 12 o'clock position of the eyeball, which is the top. And if the top goes in top, intorsion, that is called intorsion. and the opposite of that is extorsion. So the top or the 12 o'clock position of the eyeball going inwards is intorsion, going outwards is extorsion. Okay, easy to understand. Now, so the obliques, as you know, come from the front and from the medial aspect and go on and attach behind the equator. So their main action, if you see these fingers as the muscle belly of the superior oblique, if they contract, they will cause the eye to turn inwards. Similarly, the inferior oblique, because it attaches like this, when it contracts, it will cause the eye to go outwards. So their main action is intorsion and extorsion. Now the superior recti and the inferior recti and the superior obliques and the inferior obliques have some accessory actions. So the accessory action of the superior and inferior oblique are elevation and depression, how you may wonder. So as you know, the superior oblique comes and attaches behind the equator. So when it contracts, a certain amount of it also causes the eyeball to depress. Similarly, the inferior oblique, when it contracts, it goes behind the eyeball, and when it contracts, it causes the eyeball to elevate. The secondary action of the superior and inferior rectus is actually intorsion and extorsion. So as you know, the superior rectus goes from top, attached like this, and when it contracts, it causes a certain amount of intorsion. Similarly, the inferior rectus that goes and attaches in front of the equator, when it contracts, it causes a certain amount of extorsion. So if you go back to the table we discussed earlier with all the muscle actions, you will understand that these muscles, because of their orientation and their diagonal attachments, cause a different variety of actions. But knowing their insertions and understanding the way in which they attach on the eyeball will very easily help you figure out which action they cause. And that is all that lies to this trick.
So now to summarize the actions we just looked at the model, if you look at it, the medial and lateral rectus actions are very simple. So the other thing, you can group the actions into one, as in the recti cause adduction, the obliques cause abduction. The other thing about intorsion and extorsion becomes the superiors cause intorsion and the inferiors cause extorsion. So this is very important to remember, and it could be, if you can understand it, it's easier to remember these things and therefore answer questions based on these small factoids. So a lot of time they might even ask you match the following from this part. Just which group of muscle cause which kind of action. They are secondary and tertiary actions, but it might still be asked. So if you understand how each muscle attaches and how it causes each movement, it becomes very easy to understand these actions. So finally, we are going to talk about conjugate muscles. What are conjugate muscles? So conjugate muscles, you can always be asked this question that if the right eye, we are talking about the superior rectus, what is the conjugate muscle of the left eye? So the conjugate muscle is basically this muscle that causes the same movement in both eyes. So as you know that when you have to look towards something or when you look at something, both your eyes need to work together for you to achieve binocular vision, which is another question that you may be asked, that most human beings have binocular vision, which helps us assess the speed and depth and the distance. So conjugate muscles are basically the muscles which act in tandem or in synchronization to help cause the same movement. So as you can see, if you look at, let's say, any eye position, let's take the simple one, the looking right side. So if you want to look towards your right eye, your lateral rectus has to act to turn your right eye towards the right side. At the same time, for your left eye, your medial rectus has to act to turn your eye towards the right side. So that way you get binocular vision when you're trying to look right. So the lateral rectus and the medial rectus are actually conjugate muscles. And that is a very important concept to know. So I feel like any of such questions which may be where a person is having trouble in looking at a particular direction, or which of these muscles form conjugate pairs, you get questions like that. If you have understood what I have explained about their attachments and their insertion and their actions that each of these muscles cause, if you've understood that well, I think you will have no problem figuring out conjugate muscles. So just apply what you know to one of the eyes and then just look at if the other eye was in the same direction, which of the muscles would be acting. And once you figure that out, that question just becomes very easy to solve.
So that's it. We're done for today. That's all we have on this topic of extraocular muscles. So kindly like and share the video so that other people can also benefit from this content. And subscribe to the channel if you like what I'm offering you. If you want me to discuss any particular topics, please let me know in the comments section. So, keep up the good work and all the best for your NEET.